Okay, so DVT, that means deep venous thrombosis, is a common problem, both in hospital setting and at home also. So now let us see who are more at risk in DVT at hospital settings. So those in heart failure, those with severe COPD, those having major orthopedic trauma, or major abdominal or gynecological surgery who have been immobilized for any reason, or those with the polycythemia vera, they are more prone to DVT. That is uh, regarding patient thing. But nowadays we are seeing many of the young generation people, they are reporting acute episodes of DVT. So reason why? Because of the long office hours on desk, they just keep stick to their chair and keep on doing the laptop work without moving on. So that has made them prone to DVT. So I am seeing a lot of young office guys or office going who are especially who has a desk job. So long hours sitting and no movement and continuous, that also predisposed to deep venous thrombosis. Besides this, long hour flights also predisposed to deep venous thrombosis. Yeah, very interesting and very good question, because many of times it appears as a swelling in the limb, which initially is mild and then over 24 to 48 hours increases. And this swelling is accompanied by pain. Pain is usually mild. In some cases, it is more throbbing type, but most of the time it is not that severe kind of pain. And this is the reason that most of the patients report late, because they keep on taking some painkiller and just delay it. So main symptoms are swelling and pain. Usually swelling gradually increases in next 24 to 48 hours. So yes, if the person ignores the symptoms, one is that in case of acute period, the clot may get dislodged and go to the heart, which is pulmonary embolism, which is fatal, or which can cause sudden death or heart failure also. Which is and second chronic thing is that if they ignore the clot becomes organized, it becomes thick, adhered to the wall, and it permanently damages the veins as well as their valves. So it causes post DVT or post venous valve insufficiency syndromes. So that is why it needs to be treated in time. So he should go and show it to the doctor, and should start on the medications, appropriate medications as per his age and clinical profile. And that the important thing is that medication needs to be continued for a long period, minimum 3 months, usually 1 month, 6 months to 1 year. So the duration of treatment is also important, and so the timely consulting your physician is important. Yeah, there are some signs in physical examination. Typical calf tenderness is the Hoffman sign, which is suggestive of DVT, and then the ultrasound Doppler of the vein is highly sensitive and diagnostic of DVT. So we just get the venous ultrasound of legs done, and that's how we diagnose. However, if there is associated, if we are suspecting pulmonary embolism also, so for that, CT pulmonary angiography is what which is required. So one in if it is acute DVT, that means the duration is around 24 hours to 2 to 3 days. Then usually for first week we tell patient to restrict mobilization, keep limbs up, and then regarding treatment, there is oral medications available which a patient can be directly if the patient is stable enough, he can be put on oral rivaroxaban therapy, started on that. And there is a typical regime for that, that is 15 milligram twice a day, which needs to be taken for first 4 weeks, and then 20 milligram once a day for next 3 months to 6 months. And repeat Doppler usually is done at uh, 3 months. And there are other oral anticoagulants available, like apixaban, especially in patients with kidney risk. They can be it can be started again. It can also be started as an ambulatory therapy at home, around. And then there are other dabigatran, and then injectable therapy, in which there is fondaparinux or the low molecular weight heparins, which are available, which can be given, especially if the patient is admitted. That is, as I told you, that if it occurs in hospital setting, or if the DVT symptoms is very severe. And in some cases, I'll say around 3 to 4% of selective cases, in which, especially like in postpartum DVT, as I told, that in gynecological, especially after pregnancy, after delivery, there is high tendency of deep venous thrombosis, especially in women who are anemic, so which is called postpartum DVT. In some of these patients are highly symptomatic, and they may require uh, local thrombolytic therapy, which is catheter directed thrombolytic therapy, which we give in cath lab. And for this, the patient require hospital admission. Right. So, as I told you, the diagnosis is usually based on the ultrasound Doppler of veins. And if it shows the small veins DVT, that is calf veins DVT, then usually it requires minimum 3 months of treatment. But if it involves proximal vein, that means bigger veins DVT, deep venous thrombosis, it shows, then usually minimum duration is for 6 months. And it's like that after 6 months, again, we get the ultrasound done. If there is residual thrombus, then it is further continued for 3 more months, and again Doppler is to be done and it is to be continued till the lumen is completely thrombus free. So the for small vein DVT, minimum 3 months duration, and for large vein DVT, it is 6 months duration at least, or even more. Initially, as I told, that in acute phase usually constitutes first 10 days to 2 weeks period. During that time, usually there is restriction of mobility. That means the patient does not have to walk freely. Only what we allow is the bed rest with the legs elevated, and with the mobility only for toilet or washing up or taking bath, that much. So restricted mobility for first 10 days to 2 weeks. After that, once the swelling has decreased and once the thrombus has adhered to the wall, that means now there is very less chances of it to go into heart, then the ambulation is to be started. And usually the exercise or running or jogging is to be avoided at least for three months. They should not like those who are in going regular habit of going to gym or running or jogging, they should avoid it for at least for 3 months. And after 3 months, we get the Doppler done, see that thrombus inside is okay. Then we tell them to go resume their activities. However, for going to office, uh, if it is proximal DVT, usually after 3 weeks, once the swelling has significantly subsided, the patient can go to office again. But there are some don'ts, like don't they don't have to keep their uh, this legs resting at lower place. So it has to be they need to get out of the chair, and continuous ambulation in between every half an hour. It should be done. So yes, a very important question. And coming back to what we initially started with, as I told that even in my clinical experience, I am seeing a lot of young patients who are young patients who have DVT because of their uh, sedentary lifestyle and sticking onto their chair and not moving for long duration, 8 to 6 hours, or continuously for 8 to 6 hours. So the advice one is to regular exercise, and second is during their working hours also. After they can keep an alarm on their watch or on their mobile, so we just remind them that after every 20 minutes or 30 minutes they have to get up from their chair, walk for 5 minutes, and then come back to seat. So this is what they need to do.